My name is Andrew, and this is Dr. O'Connor, the Anabolic Doc. And if you are a healthcare provider who currently prescribes TRT and androgens, then we want you to become a licensed testosteronologist. What is a testosteronologist? Because we hear that a lot nowadays as we've continued to grow. A testosteronologist is a healthcare provider with a clinical mastery of monitoring men and women on TRT and androgens, something that we have a very big shortage of right now as the growing population of men and women on TRT continues to grow. Would you agree, Dr. O'Connor?
Yes. So I'm technically the world's first testosteronologist, and everyone knows I started off as the Anabolic Doc, just a primary care doctor. And I started off 20 years ago taking care of men that were on androgens. And of course, they had harm reduction issues, steroid users. And then it moved into men that are just on testosterone. And I realized that very good doctors that are at that time, endocrinologists and urologists, you can't know everything, right? So, and as testosterone, the study of testosterone grew, I realized that there's a need for a sub-discipline of internal medicine to spend and really focus on the needs for people from a diagnostic and a management standpoint for just being on testosterone. And that's how I did it. And now we've been out there. This is January of 2025. We opened up the app with a directory. We have 20 that are on the directory today, all over America, one guy in Chile, a doctor, and we have other areas in the world that we're looking to expand, and that's why we're reaching out.
So with the landscape of medicine changing, if you're a healthcare provider, how does this benefit my practice, and what is the value proposition for me as a healthcare provider to become a testosteronologist?
Right. So I standardize this. This is a standardization. We have registration, primary registration on testosteronology, and of course the mark, the logo mark. And we have that across 3 medical fields. And it's been a lot of work with our IP lawyers. But I did that initially because I knew that this is going to be a specialty and a full day job. It's different than the anti-aging and the clinics that are out there, testosterone clinics. And again, I don't want to disparage, but all I do as an internist is formulated protective protocols and diagnostic measures to over 20 years from steroid users to regular men on testosterone and women, because we know that's a growing piece. And that's some of the testosteronologists. They know more about the women diagnostic and management than I do. I feel more comfortable with the men. But it's growing. And if you're going to be a practitioner, now most commonly a healthcare practitioner is a nurse practitioner, right? Or a physician, but it's really going to be more common in most markets. It's a nurse practitioner that has a primary care background to understand, right, the ABCD'S, if you will, and to be able to focus and deliver not just the diagnostic aspects for a new patient, but the ongoing management properly. So someone that's on testosterone can be sustainable. No one's really done it like I've done it. And again, it's been a lot of work, and I'm on the shoulders of many giants in the world and colleagues, but now this is a full presentation. This is now just a full day job where if you're taking care of someone on testosterone or harm reduction, anabolic recovery from androgens, I'm here. We are here now to train you.
And last question. I think a lot of people want to know this. Anti-aging clinics are popping up left and right. How does being a testosteronologist distinguish them from an anti-aging clinic?
Well, it's anti-aging is an interesting word, right? So in the 20 years that I've been a physician, over 20 years, I've seen where the 20 years ago, turn of the century, this is 2025, where endocrinologists, internists were stressed because of their load, their patient load.
Right.
They were unable to keep up with the quality of life issues that patients are suffering from, and they don't have the Western means. The Western doctor didn't have the answers. So then comes in the hormonal aspects, that understanding balancing hormones and treating hormones. And of course, there's always some politics, right? Because of testosterone in the 1990s became a controlled drug, which is inappropriate. And doctors get nervous, right? So they don't want to deal with that. So they stay away. And that set up a marginalization, if you will, and a whole new vacuum that was filled with anti-aging and testosterone clinics. And some of it is very, very good. And of course, it's needed. But then when you look at their diagnostic methodologies and their management methodologies, where everyone gets 200 milligrams a week, I'm not joking. I mean, I could laugh about this on the podcast, but this is serious. Everyone gets the aromatase inhibitor. Everyone gets the clomiphene or the HCG. And of course, these medicines are appropriately utilized, but they shouldn't be done cookie cutter McDonald's approach. Every man is its own. And then I've developed the protocols. And of course, I've taken care of all these steroid users for years and seen that there's going to be side effects on these issues. And I've been doing it really for over 20 years. And I said, I want to standardize this. And that's what it is. So, but it's not anti-aging or XYZ men's health clinic and all these really fancy marketing terms. It's just testosteronology. It's a subdivision of internal medicine. It's not endocrinology. It's not urology. It's a little cardiology, hematology, a little psychiatry. It affects the moods. And if you have someone that has mood disorders or anxiety, we know that even a little androgen can really hurt that person with panic disorders and moodiness. And just giving an aromatase inhibitor, that's not the answer.
So healthcare providers, I will leave you with this. With the growing landscape of TRT and androgens skyrocketing across the world, we call upon you to learn from Dr. Thomas O'Connor, the Anabolic Doc himself, and become a certified and licensed testosteronologist with us.
With that, you will come into the training program. Please initiate that right now. Come in, contact us and Andrew himself. We're getting into every market. We're already in various world markets already. And you could see on the provider list that we've provided. And this is we're always going to be changing and growing. It's a brand new landscape. If you really want to be part of this movement, you think you're a great healthcare practitioner and you're already in the space or you want to be in the space, you consider coming on board. There's a training program. You're going to be going into first an online training program. We have value on that. We have a library and videos to understand the guidelines and training for not just diagnosis guidelines that are from me and from what we've worked with the testosteronologists, that you're going to be part of this group, right, as we grow. It's been amazing. We've been doing this now for about a year, and it's just incredible what we've developed and just the brother sisterhood. It's so the community of just working together. We have twice a week, and that's going to grow. We have online meetings where we share clinical cases and you get questions, not just from me, but other testosteronologists that you see on the directory right now. So if this is your call, if this is something that you love to do and you want to be the best you can at delivering testosterone and androgens and protecting people in the world, in any market, any country in the world, please contact us and we would love to take you on board to be a testosteronologist.
We hope to see you there.
Thank you so much, Andrew.